Hello, and welcome to our Facebook Live about COVID-19. I'm Elizabeth Van Camp, and I'm a member of the University of Iowa Healthcare Social Media Team. Dr. Teresa Brennan, Chief Medical Officer at UI Hospitals and Clinics, and I will be discussing how we're keeping staff and patients safe, things you can do to take care of your health, and what we recommend you do in the community to stay safe. Thank you for joining us today, Dr. Brennan.
Sure, happy to.
This is a live broadcast, so please comment with your questions and we'll get to as many of them as possible. Before we begin, this video is for informational purposes only. So if you feel sick or are concerned about your health, we encourage you contact your primary care provider or schedule a video visit to speak to a provider. We'll include the link to our video visits in the comments below. So I want to dive right in today, Dr. Brennan. As someone who is at our hospital every day, can you tell us why you feel safe continuing to come to work even during this pandemic?
Sure. I think the feeling of safety really is about reducing the risk. And I think that one of the reasons that I feel safe here is because we've done so many things to reduce the risk. We know that COVID-19 is in our community, and we know that wherever you go, you have a potential to encounter someone who may have COVID-19. We also know that there is the potential for someone to have the disease and be asymptomatic or not have any of the symptoms and even spread that to someone else. So the things that we have done here, first and foremost, is that we instituted a face shield policy. The CDC has recommended that face masks be worn in public spots, and now more recently that face masks be worn in hospitals and healthcare hospital to wear a face shield. And we did that for a couple of reasons. One is at that time, PPE was in short supply, and it was not clear that we were going to get PPE on a regular basis. And so as you use up the PPE, then you're left with perhaps not having what you need when you really need it. Face shields are cleanable, and that was really important to us. The second part was that a mask covers your nose and your mouth. But when people wear a mask, particularly people that are not used to wearing a mask, and although many of our docs and nurses are used to having a mask on, many people that work in the hospital aren't. When you're not used to wearing a mask, you tend to touch your face a lot. And we've talked about the fact that touching your face is really problematic. And so the face shields that we are using actually prevent you from touching your face. You actually have to try to touch your face in order to do it, because they really cover your whole face and they come around the sides towards your ears. So for that reason, we put face shields in place. And that, I think, was a really good thing to do. And I think it's protective to the people that are wearing them and protective to the people around them. And if we can get everyone practicing these standards, then you have good safety. The second is that we've done lots of education on hand washing. We actually have had compliances where our faculty and staff, everyone had to undergo, how do you wash your hands? How do you don and doff? Meaning put on your PPE and take it off safely. We actually recently also did a compliance that our marketing team helped us with it, with the 5 things that are important to keep yourself safe. And social distancing was a big part of that. Keeping your shield on, big part of that. And so all of these things really help us to keep people safe. The last thing I'll talk about is our screening. So if you enter our hospital as a patient or a staff, you have to undergo screening, where we ask you a series of questions about many of the symptoms that people with COVID have that we would want to know about. And if you have those symptoms, we actually ask you to turn around and go back and have a televisit and really see if you need to be evaluated further. After that verbal screening, going through those symptoms, everybody walks through an area where we have thermoscanners, which look for our temperatures. And so everybody who comes in gets their temperature taken. So for all of those reasons, I feel like this is a very safe place. If you walk into our local grocery store or into any place that you might need to go for essentials, the gas station, those sorts of screenings are not in place, and they're not necessarily all of those recommendations for people to wear that protective equipment.
Yeah, such a good point. So you mentioned the screening process. For those who haven't been through it yet, is it a long process? Is it pretty easy? I mean, there's obviously we observe social distance, but could you just talk a little bit about that to explain it to people?
Yeah, I mean, the process is pretty quick. We have several screeners who are wearing personal protective equipment and standing actually behind plexiglass for another level of protection for them. You walk up to them, they ask you if you've had a fever, a sore throat, a cough, or shortness of breath in the last 24 hours. And you say no, and you move on. And then the temperature scan happens. Most of us don't even realize that we're being scanned. It would only be if the scanner would pick up that our temperature is elevated, we'd be stopped, and then a manual temperature would be taken to confirm. And if someone has a temperature, then again, we would refer them on for a televisit. So it's pretty quick. The one challenge that we do have is we have a lot of people coming in to work at certain times. And so during those times, the line can become longer. And so even longer because of social distancing. So that may be a little bit of a slowdown, but I come in every day and it really doesn't slow me down.
I've been through it just a couple times too, and you're right. I thought it was a camera or something, just like an actual camera. I didn't even realize it was taking my temperature. Yeah. And very quick. The screeners are always so great about just getting you in as quickly as possible. So it is a pretty efficient process. So when patients are coming to the hospital, are we asking them to wear face masks, or, like we're asking people, or the CDC is encouraging that in public, do we want people wearing them when they come to our hospital too?
Yes. I think the more each individual can protect themselves and others, I mean, the face masks really are for source control, so that if I happen to have COVID and I'm wearing a mask, I'm protecting the people around me. And if we're all doing that, then that protection really extends to everyone. So the CDC does recommend that you wear cloth face mask if available in public spots, in public places, which we certainly are a public space. But also most recently are recommending that everyone wear them when they're on a health campus. So yes, we want our patients to have a cloth mask and wear it when they come in. And if they don't, we're working on a mechanism to provide a mask for them.
Great. We have a question from Facebook, so I want to make sure we get to that. Patsy asks, I'm coming for a surgery. Can I bring a small suitcase with some things? I have a cloth mask. Should I wear it when I come in? So we just touched the cloth mask one that, yes, we'd like her to do that, but what about the suitcase? Or I haven't really thought about that.
Sure. So Patsy, if you're coming in for a surgery, you've probably been told that we're going to test you. Because when people have surgeries, there is potential for the people in the room to be exposed in a much more serious way. And so we are testing patients that are undergoing procedures or surgeries the day before. And then when you come for that test, and when you come for your surgery that day, you should wear your cloth mask. And you can bring what you need. We want you to have what you need to be able to.
Thanks for answering that. So we've talked a lot about social distancing over the past month or so, but can you just reiterate for us how social distancing helps protect our community?
Yeah, the point of social distancing is as we breathe and as we cough, some of us as we speak, there might be droplets that come out. Those droplets have a really defined distance, and I know that there's been things in the media about maybe that distance is longer than 6 feet. But in general, for most people, a 6-foot distance gives that protection for those droplets to not land on a person. And so in a time when you have a virus that is really transmitted through droplets, that separation is really important. It's hard though, right? Because most of us as human beings, that 6 feet seems like a far distance.
Yeah, the grocery store I go to does an announcement while you're there that says, try to put 2 carts between you to give you a visual, and then you visualize 2 carts, and that is a big space. It is difficult to remember, but that's anytime we can have those visuals to help us remember, that's helpful.
Another visual that we've used here is that if you put your arms straight out and the person next to you puts their arms straight out toward each other, and your hands don't touch, you're in a good safe spot. If your hands touch, you probably need to move a little bit away from each other.
That's helpful. So Is it possible to gain herd immunity from COVID-19, Dr. Brennan?
Yeah, I mean, we've talked a little bit about herd immunity, and I think that there's a couple of ways that that can happen. It can either happen by people getting the virus, and then the people in the population or the herd, so to speak, becomes immune through the transmission of the virus. I think during one of these we talked about when many of us were kids, parents used to do, like chickenpox parties to get that herd immunity, that people would get it and get it open.
Mm-hmm.
This is not a virus that we really want to encourage transmission of. Most people are going to do well with it. It may be pretty uncomfortable, and they will feel pretty bad when they have it, but most people are going to do well. The fact of the matter is that some people will not, and some people will die from it. And so having an objective to have herd immunity by people getting immunity through the virus and having the disease isn't a good idea. The other way we can get herd immunity is by people getting vaccinated. So if you have a certain percentage of the population that gets vaccinated, they then become immune through the vaccine, and their likelihood of then transmitting the virus to other people in that population goes down. And that is the way that we really want to develop your herd immunity. So, we're all hoping and praying that the vaccine comes soon.
Absolutely. And our researchers are working hard to contribute to the research that's going on for working for vaccine, correct?
Yes.
Right.
Yeah. Lots of studies are going on here. The vaccine trial, the vaccine development is just one of them.
Right. Well, if you're just joining us, we're here with Dr. Teresa Brennan, Chief Medical Officer here at UI Hospitals and Clinics, talking about your healthcare during COVID-19. Please comment with your questions and we'll answer as many of them as we can. So what are some things that you recommend for taking care of our physical and mental health during this time?
Lots of stressors and things that we have to do are causing people to maybe not do the healthy habits that they were used to. So from a physical health standpoint, for sure, getting good hydration. So drinking water, making sure you're getting well hydrated through drinking water, and getting enough sleep. And then the normal healthy things that really are helpful to all of us, having a good healthy diet, and getting in exercise. And with the gym closed, that can be hard for people to get in exercise. But remember that you can go outside. You just need to stay away from people. But the weather has gotten nice.
Mm-hmm.
So it's great to be in Iowa with good weather. So get outside and do some exercise. And I would say also the ability to have a healthy diet is challenging as well, right? Because most of us are trying to avoid going to the grocery store as frequently as we used to.
Mm-hmm.
So just trying to make sure that, if you're not going frequently, things like frozen vegetables, frozen fruit. I recommend my patients usually try to avoid things in cans because they're very high in salt. But just focusing on our diet. From a mental health standpoint, I think it's really important that we continue to interact and socialize with people, and I think Facebook is a great way for that. I think there's a lot of people that are getting together by Skype or by Zoom or by FaceTime. So keeping your family and your friends close, using them as your advocate and being there, I think is really important. I think that exercise is really important and getting enough sleep. But I think just having a positive attitude. And I think the one thing I would say about this virus is, although it's very scary to most of us, you can do a lot of things to decrease the risk. And so if you focus on the positive, if you're washing your hands, you're doing social distancing, you're wearing your protective gear when you need to be, then those sorts of things can really decrease the risk, and you can have a positive attitude that you're going to get through this. We just hope it's soon, right?
Yeah, thank you for framing it that way, because I think it's hard to remind yourself that there are a lot of positives. There are a lot of things like people are slowing down or maybe connecting with their families more, and it's not ideal. And there's like you said, there's a lot of scary things, but that's a good reminder to try to frame things in the positive and to remember what we can do. So thanks for that reminder.
Thanks.
So when out shopping for groceries or other essential items, how can each of us work to protect ourselves, our fellow shoppers, and even store employees?
Yeah, I'm hearing that many stores are requiring their employees to wear face masks. I think that's a great thing. So I think it's really just being vigilant about the things that we have been talking about from the beginning, right? Whenever you touch a surface that, isn't a surface that is yours, like it, when I'm at my desk at the office, I know no one else has touched it, right? I still clean it regularly, just to be sure.
Sure.
But when you go into a grocery store, you don't know who's touched things, who's coughed on things, who's sneezed on things. And so just being very vigilant. I know there's a number of people that prefer to wear gloves, and that's okay. But if you're not used to wearing gloves, those can give you a false sense of security. And you put on the gloves and then you touch lots of things and then you touch yourself.
Mm-hmm.
So just be very careful if you're going to wear gloves. My preference is to have something available to wash your hands on. So when you go into the store, wipe down the cart. And then periodically, as you're moving around, if you have a small bottle of hand sanitizer, just to intermittently wash your hands. As I said earlier, the CDC has recommended that we all wear cloth masks when we're in public spaces. And so I think that's a good recommendation and would certainly recommend it to people going to the grocery store. And then remember, when you get back to your car and you're getting in and you've pushed your cart away and you are going to go take your mask off because now you're going to be in your car by yourself, remember to wash your hands. I think it's just a good practice to think about the things you're touching and make sure if you're touching something that you wash your hands after before you touch yourself or touch things that you're going to continue to touch. I'll tell you a little story. I actually picked up groceries at a grocery store yesterday, so I was sitting in their car lot waiting, and I saw someone come out of the grocery store, and she had on a mask, and she unloaded her groceries, and she pushed her cart to the cart cage or the place where you put your cart. She walked back and she pulled the mask off her face, clearly touching her face while she did it. Then got into the car and pulled out her cell phone. I mean, I could see this from just being close by.
Sure.
And I didn't see her wash her hands. So anything she's touching, she now can contaminate. And so just be very careful and very vigilant about doing all.
Yeah, that's a great reminder. And I know we touched on this the last time we talked, but I just want to review it for maybe anybody who hasn't watched this yet. When you wear your mask, you want it to go on towards the top of your nose, you want it to go underneath your chin, and you want it to fit snugly to your face so that no germs can really get in. Any other tips you have?
Right, in or out. And then try not to touch it. It's pretty common because we're not used to it, to be adjusting it or moving it around or touching. And whenever you do that, you have the potential to contaminate your face, your hands. So it does take a little bit of getting used to wear a mask.
Sure. Yep. So we have a couple more questions coming in from Facebook, so we'll touch on those. Ellen asks about reports of blood clots in patients diagnosed with COVID-19. She asks, have we noticed this and how are we treating this issue?
Yeah, we certainly have noticed it, and it's been pretty clear across the world that this is something we're seeing. People who normally wouldn't get blood clots, there's some data out there about younger people getting strokes. We certainly have seen some patients get blood clots. There's some laboratory tests that we can follow to determine whether someone needs a blood thinner, whether in the hospital or even to go home with. So those decisions are really based on an individual basis by the treating team with the patient based on their current situation. But it is more common. It's common for people to get blood clots in their legs when they're sick in general, but we're also seeing blood clots in other areas that we don't necessarily expect just because the patient is sick. So really important to know that and for physicians to be caring for that.
Sure. All right, so there are several news stories about declines in emergency room visits for heart attacks and strokes, but people aren't having fewer heart attacks and strokes, right? So can you explain to us what's going on there?
Yeah, we don't think that people are having fewer heart attacks and strokes. There's no reason for us to believe that. As a matter of fact, when people are ill, we tend to see more heart attacks because they're ill with the virus, and they can have a heart attack just because of the scenario they're in, the environment, the stresses, etc. So we think that it's probably because people are waiting at home because they're concerned to go and seek medical care. And heart attacks and strokes can be very challenging to know what's going on, particularly a heart attack. Many people don't have the classic symptoms that we talk about. They might not have chest pain, or the chest pain might be different than what we've heard about as a heart attack. And so it's not unheard of that people might sit at home through a heart attack just in normal time. But now I think what we're seeing, we are seeing nationally that there is an increased number of sudden cardiac death in patients. And so putting two and two together, we feel like people are not coming into the hospital because they're concerned. And I want to make sure people really understand that we talk about COVID-19 a lot in the state, but we can't forget that people have other medical illnesses, and we can't not treat them, because then they'll have bad outcomes because of those other illnesses. So if you out there are having medical symptoms that are unusual for you, or any symptom that could be consistent with a heart attack or a stroke, you should seek medical attention, because we would hate to have something bad happen to you because you're fearful of something that might happen.
Great. So on that same topic of keeping patients safe and being a safe place for people to come, how are we keeping patients safe before procedures at our hospital?
Yes, we talked about it a little bit with Patsy. We are testing patients that are undergoing procedures or surgeries so that we know whether they have COVID-19 or not. And as has been discussed in the local media and the national media, there certainly are patients that don't have symptoms. There are also patients that may test positive before their symptoms are actually seen. And so we're doing that testing. Everyone who takes care of a patient is wearing the face shield that we talked about, and a medical grade mask. So all of your care providers will be in that here at the hospital. And then, they're doing all the good things that they should be doing to take good care of us and not have any sort of infection. It really starts with hand washing, really focused on hand washing, making sure that, all the surfaces are cleaned that need to be cleaned. Housekeepers are doing a fantastic job. And then really trying to social distance as much as possible. And that really brings us to the visitor policy. So it's really heartbreaking to have a patient come in for a surgery and not have the support of their loved ones around them. But in order to keep our staff and our patients safe, we have really restricted visitors. And we will continue to do that, at least in the short term. These are decisions that we thought about a long time before we made them. And we continue to talk about when we might lift that visitor restriction. But for now, we still have pretty strict visitor restrictions. But for the most part, no visitors. One visitor for pediatric patients, a visitor for patients coming into the ER, because that's a very challenging time. And decisions might need to be made, and the patient may or may not be able to make those. And then we are making in certain situations.
Yeah, and we're also utilizing our communications liaisons to make sure that if people want to connect with their family digitally or virtually, they can.
And we've had really good feedback from our patients about communication liaison. They're in general, they're clinical staff, so they understand the medical terminology, but they're also helping them with the technology to communicate with their family members, and really trying to make it as seamless as possible for the family member to be involved in the patient's care, and for the patient to know that the family member is there and supporting them.
Sure. We have had some questions from pregnant patients who are due soon, and they're wondering if their partner will be able to be there with them. Is that typically one of the exceptions that we're making?
Yeah,
Okay.
Your partner can be here.
Great.
It's a pretty important time in life, right?
Yeah, absolutely. So we've got a few more questions from Facebook. So Mary asks, masks protect others from us. how do we make sure to protect ourselves against any droplets that may be airborne? So is that just still face masks, or what do you think?
So the goal really is for everybody to do it.
Mm-hmm.
And then the source control helps to not pass it to the next person. There's no data that non-medical masks decrease the risk of the person wearing the cloth mask getting something from others. That's not to say that there may not be some. So certainly you should wear it. Also thinking about the transmission, the droplet transmission, making sure that you're washing your hands frequently and not touching your face is really, really important. And then that social distancing really can't be stressed enough. And we all have to really think about it. We see it in the hallways here as people are walking. You have to think about 6 feet all around you, right? It's not just in front of you, but it's also the person beside you. We are seeing, one of the silver linings of COVID is we're seeing the kindness and compassion of people come out to, just a wonderful degree where, people are stepping back and letting others go ahead of them. And, lots of excuse me's, lots of smiles and interactions that really are good for people during this time when people are stressed. It's really good to have that goodness come out.
Yeah, it really hammers home the phrase "in this together." We all have to play our part, and we're all helping each other get through it.
Right.
Another question from Facebook is from Laura, and she said, "Are contact lenses still okay to wear if we're vigilant about cleaning our hands?" Is there any concern there?
I've heard some data about COVID-19 being transmitted with contact lenses. I think if you are a contact lens wearer, which I am, you know that before you touch your lens, you should always wash your hands. Just be sure to do it for that 20 seconds.
Great. So Rita asks, when the hospital opens for elective procedures, what will be the protocol for the person driving a patient in? So are there any protocols for that? If a driver is high risk is one of the people who's more at risk for getting the virus, should they not come? Do we have any information about that?
We do. And unfortunately, for the most part, we are not allowing your driver to accompany you in the hospital or go to that procedural area with you. Again, we are making exceptions, and those exceptions are really discussed when you get the call about what's going to happen on your day of procedure. That generally will come the day before. So there'll be a conversation. There are some patients, for example, patients who have dementia that really can't function by themselves. They need their caregiver there. Those would be patients we would definitely be making exceptions for, so that driver, that caregiver would be able to come in as a visitor. For those that can't come in, we have a couple of places here that are kind of like the cell phone lot at the airport where people can wait. It can become a long time for some of the procedures, so we're having conversations about what else we can do and hope to have some more options in the near future. If you're local, you could go home and come back, but many of our patients really travel a distance to help them to find something to keep themselves occupied and busy while they're worried about their loved one, but not have it be in a place where they're close to others.
Sure. Thanks for that update. So we've talked about video visits and telemedicine over the past few months, probably more than we have in a long time. Can you explain what telemedicine might be right for and whether or not everyone should be using it? Should people just be coming in to see their doctors again? Just explain that process for people.
Yeah, so we're offering options for patients. We certainly know that some patients do need to come in and see us, either because their exam is really important and a part of determining what to do next, or some patients need lab tests or studies done. And so the day before, someone from the clinic is calling the patients, or maybe even a few days before, to talk to them about what the best option for them is, whether it's better for them to come on site or to have a telephonic visit, which just means we call them on the phone. We can't see them, but we can certainly hear them and talk to them about how things are going, or a video visit. We are transitioning to more on-site as we're seeing that patients really need to be seen by their doc. I had clinic this morning, and there were several patients that I saw on site, and it was really good. One patient's blood pressure was high, and we may not have known that. And other patients needed studies that they would have had to come on site anyway for. But the video visits are working very well for patients that don't have that need, but do need to connect with their doc, maybe for medication management or just to make sure things are going well.
Sure.
It really has been functioning very well from my standpoint. Patients are very appreciative that they're making that connection and things are going well. And, you know, we've certainly had some where we start with a telephone call or a video visit and ultimately have to bring the patient on site because we identify something. So I think the most important thing is it's individualized. It's what you need and what your doctor feels like you need. But it's a great way to maintain a connection with your doc, particularly for someone who has some chronic medical illnesses that really need to have that continued medical interaction.
Great. Can you explain the process of evaluating a patient for COVID-19 and how diagnosis works?
Sure. So we have chosen to do the first evaluation telephonically or by video visit. And the reason that we've done that is twofold. One, we can get it done pretty quickly, and that's really good for the patient. And the second is it decreases the risk of exposure of that patient or other patients who may have COVID-19 or influenza or any other communicable disease. So video visit first if the patient seems like they either need to see a doctor because they're not doing well or they need to be tested. Then we would bring them into our respiratory illness clinic where they would get the care that they need. So pretty efficient. Testing can be done in that clinic. And the test generally is taking about 6 to 8 hours. If it's at the end of the day, it may not be back till the next morning. But someone is giving people a call about what their test results are and then what to do next. Great.
So Steve from Facebook asks about the number of COVID-19 cases we've seen, and then he's got another question, but I want to give you a chance to answer that first question first. So how many cases have we seen?
So we've diagnosed just over 500 cases in the clinics. And we've had, and I haven't seen the numbers this morning, we have about 25 patients in hospital and have had about 120 patients having been in hospital and subsequently discharged. Those 25 are in that 125 number, 120 number. So those are about the numbers that we've seen. The vast majority of them have been adults.
His next question is, are there any numbers we can share or data about how we're caring for patients in the hospital and at home? So you touched on that the last time we talked a little bit about our virtual hospital. So maybe you can explain that again.
Yeah, our numbers, and I don't have those numbers right in front of me now for since our last Facebook Live, but all of the patients that have a diagnosis for us get a home treatment team that calls them. And for many of them, they're calling them every day. So they get a nurse call. We also deliver a kit to their home that has important numbers to call, has a list of symptoms that we would want to know about that might mean that they're getting sicker, might need more treatment, might need to come into the hospital. And it has a blood pressure cuff and a pulse oximeter. So a pulse oximeter is a small device that you put on your finger, and it shows what your oxygen level in your blood is, and it also will tell you your heart rate. And we found that those have been very helpful when our treatment team calls every day, because if people get dehydrated, their heart rate tends to go up, their blood pressure tends to go down. And those would be people that we'd want to really focus on coaching them to drink. With that, our numbers have been much better than what we've seen nationally. I don't believe we've had a death in that group yet. We've had some patients admitted, but it's less than half what we would have expected based on the national and international numbers. So really proud of that team. They're doing a really great job. And, we're an academic center, so we're learning a lot about, because we're able to see the entire natural history of a patient, Generally when someone gets sick, you make a diagnosis. When they get sicker, they come in the hospital. We're seeing patients daily, see how they're doing and what their transition from day to day is, and really developing good hypotheses about how we can best treat them. I'm really proud of the team. They're doing a really good job.
Yeah. So on that same line of learning as much as we can about the virus, can you update our followers about some of the things that are happening at our hospital or in our research labs, like the remdesivir clinical trial and things like that?
Yeah. So remdesivir is an antiviral, which means it acts directly on the virus. I believe it was originally created for as an HIV drug. It's given, there's two trials going on here. One is a critical disease trial where someone is very sick in the ICU. The second one is a moderate disease trial where anyone who's admitted to the hospital could potentially be a candidate to get it. I saw some good news yesterday that the early results are being very promising for that trial, so we're really pleased that we're able to deliver that to our patient. The second investigational drug, not really a drug that we're delivering to patients, is convalescent plasma. So for many communicable diseases throughout history, there has been opportunity to take plasma from someone who's recovered, which has the antibodies, and give it to someone who's fighting the disease. And that's really what the convalescent plasma does. We've had really good people volunteering who have recovered from COVID-19, who are giving their plasma so that we can give it to our patients. And to date, we've not had anyone had any serious reactions to it. So whenever you give blood products, we worry about that. And we're still monitoring the outcomes to see if it's having an effect. We also have researchers that are working on the vaccine. And we have a new study that's going to be coming out soon, looking at healthcare providers and giving them a prophylactic medicine that they would take before they got the virus. So lots of research going on, and we're excited to see the outcomes.
Yeah. So speaking of the plasma, the convalescent plasma, we've had a lot of people ask if we're going to do antigen testing on people who think they may have had COVID-19 but aren't sure. Is that something that we're going to be doing in the near future?
We've had discussions about it. At this time, it's a little premature to say we will or won't. I can tell you that we do have the technology on site to be able to test for the antibody to make sure that, or to determine if someone has been exposed to the virus and had enough exposure that they would begin to make antibodies, even if they didn't show any symptoms. But at this point, that testing has to be validated because we want to make sure that it's accurate and in our hands, as well as the technology itself. So we're probably at least a week or so away from making a decision about whether to test people if we have carriers that are asymptomatic.
Great, thanks for that clarification. So another question from Facebook is, a lot of people are wary about leaving their homes right now, even for medical appointments. How should people make the decision about whether to keep their appointments or cancel them at this point?
Yeah, it's a really good question, and I'm glad that you're asking. I think it's really important that we not just focus on the medical condition of COVID-19. So I think that it should be a prioritization, just like you would prioritize, if you're going to go to the grocery store or not. It's really about need. And so if you're feeling great and aren't having any symptoms and your medical conditions are under great control, then you might want to have a call with your provider and talk about whether that visit could either be done by telephone or by video. But if you're having symptoms, you shouldn't delay. So if you need to go to the emergency room, you need to go to the emergency room. We certainly don't want a bad outcome to happen again because you're concerned about something when there is something going on that could have. So it's an individual decision. It needs to be prioritized. And I would utilize your healthcare team to help you to prioritize that. they might ask questions that you aren't thinking.
Yeah. All right. Thank you for that. And so I know we've already talked about testing a few times, but a specific question that has come up time and time again on our social media is everyone who has COVID-19 symptoms being given an official test now, and why or why not?
So that's a hard question to answer, but I'll do my best. So when we talk about COVID-19 symptoms, I think the one thing that's been constant throughout all this is change, right? So we've learned that there are new and different symptoms that people might have. So with that in mind, not everyone who has symptoms is being tested. And that's really based on the availability of the test. I know that the governor is rolling out Test Iowa, and that may increase the ability to us to test a broader group of people. We certainly are testing lots of people here, but there may be some people, particularly young people, who have some symptoms that don't meet criteria. We have pretty strict criteria. Every lab has those. Commercial labs maybe less so, but the length of time it takes to get those becomes a bit of a challenge. So we here at the University of Iowa have significantly broadened our criteria, meaning that it was very focused in the beginning on a smaller population, and now we're testing a much bigger group. But it is possible that you would not be tested based on your symptoms.
Great reminder about change, because you're absolutely right. It's, it seems like every time we get a good hang on what's going on, this virus throws another curveball our way. And so it's a good reminder to be patient as patients with the medical community, because everybody's learning at this point.
One thing I will say is that our respiratory illness clinic has been very good. If you have some symptoms but you don't meet criteria for testing, they may contact you again the next day or in a couple of days to see how you're doing. And I do know that on occasion, a test may not be done, but they're presuming that someone has the virus based on the fact that they have several of the symptoms, and it seems pretty consistent without them having tested. And so that could happen. I think those are unusual circumstances, but keeping in touch with a healthcare provider, because early on you might not have enough symptoms, but over the course of a day or two, you might develop enough that you would meet testing criteria.
Yeah, another great reminder to stay in touch with your team, your medical team.
Yes.
So we're creeping up on the end of our time already, Dr. Brennan. So I just want to ask you, is there anything else you'd like to share with our audience today?
Yeah, I mean, I think we've talked about it a lot, and I'm really focused on the fact that if you need to come and be seen, that you should worry about the medical condition you have going on at the moment more than the concern about COVID. Please take care and take all necessary precautions, but we would really hate for you to sit at home. And I think that, we have some anecdotal data here that we've seen that in patients. The number of patients with heart disease that has gone up in the recent weeks. Patients that may not have sought their medical attention because of concern, then end up in the hospital. And so, please take care of yourself and make sure that you're making decisions, based on everything you know about your medical history, and not just a concern about COVID-19.
Great. Thanks for that reminder. And thank you for sharing all of your expertise with us today.
You bet. Thanks so much. And thanks for everyone who sent in questions. I appreciate it very much.
Yeah, thank you everyone who tuned in and submitted questions. If you tuned in later during this broadcast, make sure you go back and watch the rest of the video, because there's a lot of good information in there. Stay tuned to the UI Healthcare social media accounts and our website, uihc.org, for more updates about COVID-19 as we have them. And remember, please wash your hands for 20 full seconds. Make sure you wear a face mask when you're out in public, and continue practicing social distancing. Thanks for watching.
Thanks so much. Stay safe.